What is mental health? The World Health Organization defines mental health as not just the absence of mental disorder. It is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. What is the incidence of mental health disorders in America? Right now, there are 15 to 18% of Americans, including nearly 10 million children, who suffer from a diagnosable mental disorder. And because the mind also affects the body, 50 to 70% of visits to primary care physicians are for medical complaints that stem from psychological factors. Anxiety and depression are among the most frequent conditions seen by primary care physicians. Frequently, these mental health problems are compounded by drug or alcohol dependency. Who suffers from mental health disorders? Anyone can have a mental health disorder. Some groups, however, experience a higher rate of these disorders than others do. Physically ill and older people are more likely to suffer from mental health disorders. More than half of Americans 65 years and older who are treated for physical illness in hospitals, clinics, and nursing homes also have at least one identifiable mental health problem. Separated or divorced people are twice as likely as their married counterparts to have a mental health disorder, according to a one-month study by NIMH. The same study indicates that at every level of society, poorer people are consistently more likely to have a mental health disorder than people who are socially and financially better off. What are the most common forms of mental health disorders? Anxiety disorders touch more people than any other mental health problem, affecting 23 million adults, or 12.6% of the population. The disorders include phobias, panic disorders, obsessive-compulsive disorders, and post-traumatic stress disorder. Approximately 18 million Americans suffer from mood disorders, an affliction roughly divided between severe depression and bipolar disorder. NIMH also reports that approximately 2 million Americans are afflicted with schizophrenia, the most chronic and disabling of the mental health disorders. The economic cost of untreated mental illness is staggering, over $100 billion on untreated mental health disorders and $400 billion on addiction disorders each year. In the labor market alone, it is estimated that up to 1/3 of days lost to illness are related to mental rather than physical disorders.
For people with mental illness, historically, several things happen. One is the co-payments that they have are typically much higher, and the risk of bankruptcy is much greater for people who are being treated for a mental disorder. And then secondarily, and this is a point that I want to echo that Diane made, is many of the services that we know are most effective aren't covered by insurance at all because they sit on the boundary between traditional medical care and social services and support. So as bad as the problem is for general medical conditions, people with mental illness have historically had to pay an even bigger share of the cost of their care, which is why parity has been so important for us.
What is the Mental Health Parity Act? The Mental Health Parity Act was signed into law on September 26, 1996. It requires that annual or lifetime dollar limits on mental health benefits be no lower than any such dollar limits for medical and surgical benefits offered by a group health plan or health insurance issuer offering coverage in connection with a group health plan. Before passage of the Mental Health Parity Act, a typical insurance plan might cap lifetime mental benefits at $50,000 and $5,000 for annual, but cap benefits for physical health services at $1 million and no annual cap for other physical disorders. Once the act is carried out, insurers will no longer be permitted to impose a different limit on mental health benefits if both kinds of benefits are part of the health insurance package. Example of a coverage provision that violates MHPA protection. Your plan has a limit of 60 visits per year for mental health benefits, along with a fixed dollar limit of $50 per visit, a total annual dollar limit of $3,000. It places no similar limits on medical and surgical benefits. MHPA does not allow this inequality to exist for group health plans covered by the law. Mental Health Parity Act key provisions. It took effect on January 1, 1998 and expired on December 31, 2007. It equates aggregate lifetime limits and annual limits for mental health benefits with aggregate lifetime limits and annual limits for medical and surgical benefits. It covers mental illnesses as defined under the terms of individual plans. Existing state parity laws are not preempted by the federal law. For example, a state law requiring more comprehensive coverage would not be weakened by the federal law, nor does it preclude a state from enacting stronger parity legislation. It applies only to employers that offer mental health benefits. It allows for many cost-shifting mechanisms such as adjusting limits on mental illness inpatient days, prescription drugs, outpatient visits, raising co-insurance and deductibles, and modifying the definition of medical necessity. It applies to both fully insured state-regulated health plans and self-insured plans that are exempt from state laws under the Employment Retirement Income Security Act, which are regulated by the Department of Labor. The Mental Health Parity Act of 1996 does not provide a mandate for mental health benefits to be offered in health insurance plans, coverage for treatment of substance abuse or chemical dependency, rules for service charges such as co-payments, deductibles, out-of-pocket payment limits, designations for the number of inpatient hospital days or outpatient visits that must be covered, coverage in connection with Medicare or Medicaid, restrictions on health insurance plans' ability to manage care, and provisions for business with 50 or fewer employees. On October 3, 2008, the President signed the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008. Key changes, which is generally effective for plan years beginning after October 3, 2009, include the following. Equity coverage will apply to all financial requirements, including deductibles, co-payments, co-insurance, and out-of-pocket expenses, and to all treatment limitations, including frequency of treatment, number of visits, days of coverage, or other similar limits. This new law builds on the current 1996 parity law, which already requires parity coverage for annual and lifetime dollar limits. Mental health and substance use disorder benefits are defined broadly to mean benefits with respect to services for mental health conditions and substance use disorders, as defined under the terms of the plan in accordance with applicable federal and state law. A plan may not apply separate cost-sharing requirements or treatment limitations to mental health and substance use disorder benefits. If a plan offers two or more benefit packages, the requirements of this act will be applied separately to each package. As under the current federal parity law, mental health or substance use benefit coverage is not mandated. However, if a plan offers such coverage, it must be provided at parity in accordance with this act. Mental health coverage in New York. New Yorkers with group insurance health coverage may enjoy access to improved mental health benefits due to legislation that went into effect on January 1, 2007. Chapter 748 of the Laws of 2006, or Timothy's Law, was named after a young boy, Timothy O'Clair, whose parents were unable to access adequate health insurance coverage to treat his mental illness. The new law requires coverage for inpatient and outpatient mental health services. The following summarizes some of the key provisions of the law. Coverage must be included in plans for at least 30 days of inpatient care and at least 20 days of outpatient treatment with a psychiatrist or psychologist in a state-certified facility. Plans must have premiums and patient cost sharing for services that are consistent with the costs for physical treatments. Plans for employers with 51 or more eligible employees must provide unlimited coverage for biologically based mental illnesses, such as schizophrenia, psychotic disorders, major depression, bipolar disorder, delusional disorders, panic disorder, obsessive-compulsive disorder, bulimia, anorexia, and binge eating. Plans for employers with 50 or less employees must offer this coverage as an option. Children under age 18 must be covered for serious suicidal symptoms or other life-threatening self-destructive behaviors, significant psychotic symptoms, behavior caused by emotional disturbance that places the child at risk of causing personal injury or significant property damage, or behavior caused by emotional disturbances that place the child at substantial risk of removal from the household.